Yeah, start the live stream. Yes, please. Okay. Apologies and substitutions.
No apologies intimated. Councillor Brown is, as I've been advised, will be joining the meeting later. Convener.
Fine, thank you. Any declarations of interest? Councillor Bell? You're muted.
I know, I'm hitting it and it's not coming off. Yes, right. Item 5, report 1322. I'm council appointed representative on the Angus Health and Social Care Partnership IGB and chair the audit committee, and I have a specific exemption for that, so I'll stay in and take part in any discussions. Thanks.
Councillor Miles?
Yes, Convener. Item 4, I'm obviously a council appointed member on Tayside contracts, and for item 5, similar to Councillor Bell, I'm Vice Chair of the IGB, but have exemptions for these, so I can take part. Thank you.
Thank you. Anyone else? No. Now we move on to Tayside Contracts Annual Performance Report. I was expecting Keith McNamara to be here, but I don't see him in the list of people attending.
Convener, I am here.
You are here, good.
Convener, sorry, can we go back? He is in attendance, but can we go back to item 3 on the agenda for the minutes?
I beg your pardon. Thank you. Minutes of the previous meeting. Are these agreed as a correct minute?
Agreed.
Fine. Mr. McNamara, please.
Thanks very much, Convener. Good afternoon, and good afternoon, councillors. Just to introduce myself, I'm Keith McNamara, Managing Director of Tayside Contracts, and with me this afternoon are my colleagues, Dougie Mackay, who's Head of our Operations team, and Frank Riley, who is Head of Facilities Management and Human Resources. Thanks very much for the invitation to attend the Scrutiny and Audit Committee today. We very much welcome the opportunity to share with you the activities carried out by Tayside Contracts as detailed in our annual performance report for 2021, and we greatly appreciate the challenge, scrutiny and support we receive from the committee. You may recall that Dougie, Frank and I were here in December 2020. We were reporting on the previous year's annual performance report. And at that point, I had been in post with Tayside Contracts for 1 month, and we were reporting on a year which was substantively normal, if we can remember what they looked like, it was basically business as usual, other than 1 week, which was the last week of March 2020, when we first went into lockdown. The annual performance report I am speaking to today for the period 2020-21 reflects an entirely different scenario. It's a quite extraordinary period in all of our lives. For the first 4 months of the financial year, our entire country was in full lockdown, including virtually all of Tayside Contracts activities. There was a partial lifting late summer, then a reimposition of lockdown in November, which carried on to the end of the year, with some parts of society, such as schools, never fully getting back to full attendance. So as you can appreciate, that had a major impact on Tayside Contracts, especially our catering service and our income levels. Therefore, the annual report that I am commenting on today is like none that I have ever been involved in during my 35 years of local government service. Due to the extraordinary circumstances of the pandemic, not surprising, many of our normal day-to-day practices had to be delayed. And also we needed to prioritise our management and staff activities to ensuring the safety and well-being of our employees and communities, meaning that progress with many of the actions that we'd be normally reporting through an annual performance report had to be suspended. So therefore, the annual performance report you have today is more a reflection of the unique and bizarre times we went through as an organisation in 2021 in dealing with COVID compared to any other annual performance report. However, with your permission, Convener, I would like to feature some of the key highlights from our annual performance report, both in relation to some of the activities we undertake as part of the public service response to the pandemic, but also highlighting some of the significant performance achievements we were able to deliver on despite focusing on COVID during that time. So just some examples I'd like to pick out. The first one being something called Tay Cuisine. To me, that's probably the main performance.
Could you give us the page numbers as you go? Either your page numbers or our page numbers, I don't really care which.
I wasn't specifically covering page numbers, convener. I was just covering overall what the sort of main highlights are.
It's just so that the members can follow it through in the report as we go.
Okay. Well, certainly from Take Cuisine perspective, bear with me. I'll just kind of pull up the document if I can find it. From our document, Take Cuisine was in relation to, sorry, bear with me, I'll just pull up the appropriate section. Yeah, it's on page 15 of our document of the annual performance report. Now, that was, as I said, probably the main performance highlight. This was a introduction of something called, which you may know as more as the Central Processing Unit, or the CPU. This was a 1.9 million project which started food production in January 2021 and has operated very successfully over the last year in the Angus and Dundee areas. Has a potential to serve 14,000 primary and nursery pupils every day across Angus and Dundee, and the feedback we've had is excellent. I'm also pleased to report that we have now introduced that service into Perth and Canoss at the start of the year and this year, and again it's been introduced seamlessly with no complaints and with very positive feedback. I think the key highlights for Take Cuisine is that we'll not only deliver year-on-year cost reductions of over £500,000 to Angus and Dundee City Councils, it protects catering jobs for services and services long into the future. And also, currently we produce something like 5 million meals a year from that site, and we have the potential to expand and deliver up to 20 million meals per year. So this initiative future-proofs participating councils from the advent of universal free school meals, which has already been partially introduced in primary schools, which will deliver an estimated 1.5 million extra meals required to be produced across Tayside for this additional demand. And this innovation required significant changes to the workforce, and it was all delivered with no compulsory redundancies. I think the second highlight, convener, and if you bear with me, I'll just pull up the appropriate part of the document, is in relation to page, again, sorry, it's my versions, apologies, it's page 25 of the annual performance report, and that's just a reflection of national recognition. Firstly, at the National Association for Public Service Excellence, we were shortlisted as best performer in transport operations and vehicle maintenance, and also in the most improved performance in catering. And in the most improved building cleaning category, we were awarded the overall winner, which is really a remarkable achievement because these awards cover the entirety of the United Kingdom, so it's not just a Scottish award. We were also recognised at the UK Highways Award when we were finalists in the Best New Technology category for implementing mobile technology in our construction routine and reactive work. And this had several benefits, including 99.5% of defects completed within our target time, despite being in amongst the pandemic and the worst winter weather since 2010. Our average response time to dealing with faults reduced from 5.75 days to 4.5 days, and we saw a 58% reduction in pothole repair costs year on year. So again, showing that new technology is a real transformative driver for better performance and better services. I think the second last key area I'd like to highlight, convener, again flicking back to my version of the report, the annual performance report. It's the section on partnership, which is page. Sorry, I'm not seeing a page here. That's terrible. 2021 it will be, and that's just there was numerous examples of fantastic partnership working during the pandemic between ourselves and colleagues in Angus Council as we had to get by with things. But a couple I'd like to pick out. There's a real trust developed through the strong between Angus Council and our vehicle workshop maintenance staff, with us providing an effective and seamless service, keeping Angus Council staff on the move. And this was reflected by comments from colleagues in the waste operations team of Angus Council, meeting regularly with ourselves and keeping the waste vehicles on the road, obviously such an essential service, and they really expressed their gratitude during that time. And I think the success of that partnership can be demonstrated by Angus Council agreeing to an extension of the agreement for Tayside contracts to provide the fleet maintenance service by a further 2 years. I would also just like to reflect that in terms of street lighting, it's a core service delivered. There's something like 72,000 illuminated columns across Tayside, and we're delighted that our partnership has expanded now to include Angus Council, which will allow all 3 councils to benefit from the collaborative approach to service provision. And through the lockdown, just as an illustration of the types of services which were being carried out, our emergency response teams attended things like knockdown columns and cable faults, while many people were forced into lockdown measures, and it allowed people to get out and about, and a bit of street lighting and night lighting at all hours when people were really restricted in where they could go. I think the last thing I'd like to cover, Convener, before moving on is, and again, sorry, I'm just referring to the actual report, and it's page 31. It's in relation to the performance indicator part of the document, and that is the financial performance. It's a performance indicator on financial performance, and this demonstrates that for 2021 we achieved an overall distributable surplus of just under £2 million, which is £1.993 million, which exceeded our budget surplus of £884,000. Our joint committee agreed that we would be allowed to retain £274,000 to cover annual leave holidays for staff that were unable because of the pandemic to take their annual leave. But overall, that meant that £1.72 million was shared between the 3 councils as a surplus, which was still nearly double the budgeted figure. So that was quite a strong performance considering the year that we had, and contribution from all parts of the service, particularly construction, who picked up a lot of extra external work through things like Spaces for People programme, which I'm sure you're familiar with, but also our facilities teams who were doing significant levels of enhanced cleans as we were all coping with COVID. So a reflection of that is overall since 1996 we've returned something like £32 million back to the 3 councils in the form of surpluses for reinvestment into local services. And in conclusion, Convener, I'd just like to acknowledge the fantastic partnership working that's going on between ourselves and Angus Council. Colleagues across both the council and Tayside contracts have worked so hard and so selflessly during 2021 in ever dynamic circumstances. They've responded magnificently to the flexibility of the challenges, and just really grateful to Angus Council colleagues for the partnership working with them, and our own team in Tayside contracts who've delivered a fantastic performance under probably the most challenging circumstances I can recall working in local government. So thank you for the opportunity to make that presentation, Convener, and myself, Dougie and Frank would be happy to answer any questions you or the committee have. Thank you.
Okay, thank you. Bids for questions. First one I saw was Julie Bell, Councillor Bell.
Thank you. Page 30 of our papers, 31 of the report.
Page 30, 31. Councillor Whiteside.
Thank you, Convener. Page 22, please, of our report.
Okay, build off.
I think, Convener, I'm looking for page 26 of the Tayside contracts report.
26 of the Tayside contracts.
Report, yeah.
You've been awkward making me hunt. Right, that's our page 27.
Councillor Devine.
All right, thank you, Lynn. I didn't see you there. I'm just still working through the list. Yes, page?
Page 20 and 24.
Okay, I'm still working through. Anyone else? Councillor Braze?
Yes, page 31, please, Convener.
Okay, fine. Have I got everybody now? Right. Councillor Devine, page 20.
Yeah, could I just start, Convener, by congratulating Keith and his team, especially on these awards at UK level, which says a great deal for the organisation. And also, I think, for the extra work that's been done over the pandemic time, the extra cleaning which was incredibly difficult in schools and everywhere else. So thank you so much for all that. And so I've just got a couple of wee questions on page 20. That's 11 on your page about the apprenticeships. I was wondering if you are managing to attract any women. I know that was always something that when I was on Tayside contracts, we were always kind of concerned about. And also, is there scope for expansion? Because these are very kind of, well, kind of mechanics type things, whereas there might be other opportunities for apprenticeships. And then just across from that, you mentioned the translation, which is great. I just wondered if you have actually lost Polish workers or any Eastern European workers due to Brexit.
Okay, thank you very much, Councillor Devine. Yes, in relation to the apprentices, yes, that's a very important part of where we are. We have like a lot of public sector organisations, we've got an age demographic profile with a lot of older people. So I see bringing in younger people, especially with the recruitment problems that, again, public services have, is a really vibrant way to do that. I've got to say, there is still a sort of tendency for males to fulfil predominantly male roles and females to fulfil predominantly female roles. And that's something that we picked up. We do something called the Qualities Mainstreaming Report, and we have an action plan to look at that. So yeah, we still want to open it all to all genders and having that really broad mix. So very, very much open to that. In terms of moving away from more sort of technical, mechanical type of modern apprentices. Yes, again, we were actually having a conversation the other day about looking to bring in a modern apprentice into more a sort of administrative and procurement side of things, and that's something, again, I'm very much in favour of. And in terms of translation in relation to Polish, I might hand over to my colleague Frank Riley, who's got more of a handle on that as Head of Human Resources. Frank, if I can maybe call you in on that one.
Yeah, thanks, Keith. The answer to your question, Councillor Devine, is thankfully no. We are not seeing the exodus that we feared. We've really relied heavily on Eastern European migrant workers, particularly Polish employees. But we couldn't have run the care and cleaning services without them. So obviously Brexit was a big risk to us. Thankfully, as I say, while people aren't leaving, what we're losing, of course, is the steady influx. So we've always had high turnover in care and cleaning. We have about 80% of our people that are fairly static and long-serving. The other 20%, they take on these part-time jobs, maybe just to get them by for a while to kind of pay for a holiday or pay off some debt they have, and then they're off again. So while we have a high attrition rate, normally that would be met by an influx of migrant workers. That's what we're not seeing. So it's not so much people leaving, there aren't any more coming in.
And is that a problem for you?
It's a problem, yes. We have a major recruitment and selection problem right now.
Yeah, understandably. Thank you.
Okay. Councillor Whiteside, page 22.
Thanks, Convener, and thanks to Keith and your team for coming along to Scrutiny and Audit. It's good to see the report coming to the Council. As you know, I've got a bit of an interest in the food side of things, and I believe that Tayside Contracts were busy making a film to help explain how the CPU works and how the food's produced, etc. So I was just wondering if there was any progress with the film, whether we'd get to see it quite soon. And the questions that are asked quite frequently at Tayside Contracts around the source of the food, I thought might be of benefit to mention that at Scrutiny and Audit, just the drive to continue to improve the rate of local products that go into the menus.
Thanks very much, Councillor Whiteside. Yes, the film is still in production. The only reason it's not actually out there is the person that was doing it has been unwell for a period of weeks. Unfortunately, he is now back, and we're expecting at the very least a rough cut any day now. So that's been a bit disappointing, but you know, it's difficult when somebody who has completed the actual work, they've done all the shooting on site, etc., and it was just pulling it together. So yeah, I'm as keen as you to get that out to show the journey of the food. And yes,
it won't be delayed as long as the James Bond movie, Keith.
Thanks, Frank. And in terms of food, yes, again, one of our ambitions is very strongly to maximise the use of local food. There's a little working group of which councillors Nicol and Miles from Angus are on that, along with local producers in the National Farm. So we've done a question and answer fact sheet for local producers to link them in with ourselves and maximise their delivery of food to Tayside contracts. And we were due to have an open event, open to all food producers, with some of the main bulk suppliers that we have, you know, like companies like Breaks Brothers, etc., and also the NFU, to have a proper dialogue and, you know, opportunity to really make connections with the local producers. And that's been put back slightly again because of the restrictions. Hopefully with restrictions easing, I'd like to think we'd be able to get something going in February, but we are extremely keen on working with local producers, because I see that as part of what we'd like to call the unique offer for Tayside contracts. That's local food being eaten by local young people in local schools, which is healthy, safe, nutritious and delicious. And I think that's what differentiates what we provide in Tayside contracts and our meal service from other providers. So again, really strongly in favour of that, and unfortunately the pandemic's kind of got in the way in some of our plans with that, but mad keen to keep going with that one as well. So thank you.
Thanks, Keith. Great news.
Councillor Devine, page 24.
Yes, thanks. I know there was a plan proposed to increase the uptake of school meals, but I think, unfortunately, we seem, in Angus anyway, seem to have seen a downturn in the uptake of free school meals, particularly in secondary schools. Can you tell me if the action plan is starting to work? Are you seeing any improvements there?
Thanks, Councillor Devine. It's incredibly frustrating because we have the situation where something like at any point in time there's 3,000 young people across Tayside who are off school due to COVID or self-isolating. We have a major issue. I think you're absolutely right. We have a major issue with young people, particularly in secondaries. I can understand that they're kind of cooped up all day. They're wearing masks all day, and when it comes to lunchtime, I would suggest that the last thing they want to do is stay in the school grounds. They want to get a bit of freedom, etc. So you're absolutely right. We are finding a significant reduction in the uptake, particularly in secondaries. We do have the action plan. We are implementing it, but I think it's very difficult to benchmark the results of the action plan and what the outcome of that in such strange times as we have with COVID. But we have the action plan. It was approved by the Joint Committee last year, and we are working our way through it. It's very early days, and it is just a bizarre set of circumstances because of the pandemic.
Yeah. Okay. Thank you.
Excuse me, convener. Sorry to interrupt. I could maybe just add to Keith's response in relation to Councillor Devine's specific question, that as part of the community planning partnerships tests of change around service design, we've got a particular project working with Tayside contracts in terms of using service design approaches to address that issue of the lower uptake of free, young people who are entitled to free school meals. So that's running in parallel with the Tayside contracts work action plan, and Tayside contracts are a key partner working with us on that.
Thank you, Mr. Armstrong. Councillor Duff, page 27.
Yeah, thanks, convener, and thanks to Mr. McNamara and his team for the report, which I thought was very informative. And it's also good to hear that the Tay cuisine is going well. I think a number of my colleagues were quite keen to when it would be safe and appropriate, etc., because it's clearly it's been a big change, and there was at the time quite controversial, but it's good to hear it's going well. My question really on page 27, one of the, like most elected members, I get complaints about roads, so I'm quite interested in this innovative work that you've been doing, I think, with Dundee City Council. And Just to briefly to explain how and I'm pleased to see that we are looking to see that moving that to Angus quite soon, because obviously I think our road service is excellent. I've always found it to get very good, but obviously you can look at later in the report, we've got a big backlog of road repairs. A lot is down to the amount of money we're spending on it, which is never enough. So I'd be quite interested to hear a little bit more about that and when we might expect to see that rolling over to Angus. A second question just prompted by Councillor Devine's question earlier on. There was a lot of excitement a few months ago about HGV drivers. Has that been an issue for Tayside contracts?
Thanks, Councillor Duff. If you may, I'll try and answer the second question, and then I'm likely to pass over to my colleague Dougie Mackay, who's head of operations and much more closer to the action in terms of the mobile solutions that have been introduced for roads. Yeah, we are sort of holding our own at the moment with HGV. We are down on numbers. We've actually devised a strategy in terms of looking at filling of recruiting into a lot of our difficult posts, which we're about to implement. It's not caused service failure, but it's caused a lot of nervousness, if I can put it that way. And I think the challenge is that the private sector do seem to be paying significant more. You've probably seen in the media around golden handshakes, etc., for people joining. It's not massively affected us at the moment, but we know it's something we absolutely have to be alive to. And if I may, Councillor Duff, I'll pass over to Dougie Mackay to talk about the roads project.
Thanks, Keith. Afternoon, Councillor Duff. I don't have a specific timescale to say that when things may be sort of rolling over into the Angus area. Basically, what's happened is through the formal partnership within Dundee City Council. Actually, each of the council areas deliver their services slightly differently, and what this relies on is an asset management system to push and pull data. So within Dundee, our WDM system is used. So information is picked up and then is pushed through the mobile technology. Within Angus Council, they don't operate that particular asset management system, and I know it's something that's been ongoing and being reviewed within the Angus area of what the right system is to go to. I think what has been identified within the annual performance report is that there is a collaborative approach from all three council areas and Tayside contracts when something is being developed, that information and knowledge is shared rather than it being kept in isolation. So it's that knowledge, it's that experience of how that's been developed is what can pass over into Angus Council, because I say slight differences in how the services are approached. Tayside contracts aren't the only one who deliver on these services within the Angus area. There's other third parties. So I think that's where sort of the challenges come in about how that transfers across. But it's more about transfer of knowledge and information rather than reinventing the wheel.
Okay. Right, can I call Councillor Brays? He said page 31, it's actually page 30, Kenny?
Yes, well, it's around thanks convener, it's around the KPIs. I noted earlier in the paper, I think page 17, the £76 million turnover, I think. And it was just, if you could maybe explain it just to me again, for my own peace of mind, about how your explanation of the surplus that was delivered to the three shareholding councils.
Thanks, Councillor Brays. Yes, yeah, I did go through that one very quickly. Sorry, apologies. So basically, what happened is at the end of the year, the surplus that was made by Tayside contracts in totality was £1.993 million. There was, during the year 2021, So there were some staff unable to take holidays, either because within the sort of COVID rules they weren't allowed to take holidays, or they were so busy doing essential activities that we couldn't give them up to take their holidays. So therefore they carried forward holidays into the next year. Because we had to then pay for those holidays, we had to make provision for that, and that's where the £274,000 came from that, and that's why the Joint Committee agreed that we could take that £274,000 from the £1.993 million, put it into our reserve, which would then carry the money forward into the current financial year, which would actually pay for those staff's holidays.
That's fine then, and so that would take the actual down by 270,000. Yeah, that's fine. Thank you very much.
And finally, Councillor Bell on the same page, 38.
Yep, thank you very much, Convener, and thank you, Keith, Frank and Doug, for coming along today. Really value the content of the report. Councillor Whiteside kind of touched on one of the KPIs that I was interested in around that the local food growers and producers, because the other side of that for me as well is the reduction in relying on importing food from quite far afield. So, for example, chicken products from the Far East, or even buying in frozen mashed potato from somewhere when Angus is the potato centre of the universe, as far as I'm concerned. So I wondered how that balances out and what your ambitions are around that. And in terms of business development, I fully appreciate the challenge and period that this report covers, but I wondered what your ambitions are around that. And the final line of the KPIs around the eco pay statement, what you're saying there is that a satisfactory outcome has been delivered from audit. And does that mean specifically that you've addressed all or any gender pay inequalities, and that we're completely finished that? And it's fully addressed, because I think that's quite an important one as well. And finally, just a wee comment I'm going to sneak in. I'm really pleased to see the work that you're doing on the employees' health and well-being. I think that's so important, and my history in the councils around employee health and well-being, they're our most valuable asset, and it's great to see them being recognised as such within your document. Thank you.
Thank you very much, Councillor Bell, and I totally echo what you're saying about employee health and wellbeing, and Frank and his HR team have just done an outstanding job in terms of supporting people with their mental health around these really difficult times. Going back to your other points, yes, I mean, I'm absolutely with you. I think it's regrettable if we are importing food from somewhere in the world when we're growing it here. There are some, and I'm 100% behind making sure that we maximise local produce. I've got to say it's not sometimes quite as simple as that, and just a couple of wee examples of things that get in the way a wee bit. Firstly, because we produce 5 million meals a year, you can just imagine the scale of food that we need. So I kind of, and if I can be really simplistic about it, a local producer coming up to the back of the school gate with a couple of sacks of potatoes is not going to cut it from our point of view. We really need volume, and I think that's where perhaps local producers might not have the scale to supply Tayside contracts direct, but they might have some sort of scale to be part of something which is supplied by one of our major suppliers. So they would be the supplier to our suppliers, as it were. But the net effect is it would be local food going for consumption by local people in Tayside. So that's the first, it's one of the things that's difficult to kind of get your head around, how it's just not so straightforward. The second one is we have at least one example of a local producer who did serve Tayside contracts and had a good sort of engagement with Tayside contracts. And they actually grew so big that they are now supplying supermarkets, and Tayside contracts are now too small for them. So sometimes some suppliers are either too big for us or they're too small for us. and it's how we get that happy medium. But that's exactly the sort of thing I want to work through with the local producers and what we can do to help and support them. Your point about business development, yes, although it's been difficult times, we have what we call a collaborative and commercial matrix. It's a sort of hit list of potential business development opportunities, which we take to our management team and review from time to time. We've got a couple of things in the pipeline, which I wouldn't necessarily want to talk about in a public forum, but there are potential very significant business opportunities we're pursuing at the moment. So yes, that's very much the agenda. Obviously, it's difficult times financially, and the more business we can bring into Tayside contracts, the more sustainable we become, and the more surpluses we can return to the council. So yeah, please be assured that we are on that. And one of the things I didn't say was we in February of this year we've produced a new business plan. So that kind of sets out our agenda in terms of different areas. So things like more commercial and more collaborative activity are two of the main features of that business plan. And yes, equal pay. Yeah, oh yes, we have done the equal pay audit. I think what the equal pay audit has done is identified some pretty significant issues that we need to deal with, and we have that in an action plan. So it's definitely not done and dusted. There's a long way to go, but I think the first step is knowing what you maybe didn't know, and then we can take action on it. I wonder perhaps if I can pass on to Frank, who's leading more on that. Perhaps there's more is worth saying, Frank.
Yeah, I think the important point is, Keith, I think what you were referring to there in terms of the equal pay audit and the actions that we're looking to take going forward, they're more in relation to embedding equalities and diversity across Tayside contracts, and more about, for example, the gender, closing the gender pay gap. Now none of that is related to equal pay. Equal pay is equal work for equal value. Now, purely in relation to equal pay, I can assure you, our audit concluded we're bomb-proof on equal pay, and that since 2008, when we introduced single status, we haven't had a single successful equal pay claim against Tayside contracts. So purely on the equal pay side and the financial risk associated with equal pay, we're on top of that. The door is closed. However, what Keith is referring to there, and where we definitely acknowledge there's a lot of work to be done, that is about, for example, somebody raised the point earlier, trying to make sure there are 9 protected characteristics within the Equalities Act that we have to make sure that we go out there and seek people from unrepresented groups for particular jobs, i.e. women for construction jobs, men for catering jobs, and then the other 7 protected characteristics as well. We've got a lot of work to do on that front, because we're stuck right now where we are. The traditional gravitation of men to construction and women to facilities jobs, that remains pretty much in place as it was 20, 30 years ago. So yeah, as Keith said, a lot of work to do on that. Mainstreaming a quality report as an action plan that we're going to follow, pursue with great zeal. We're all committed to it morally and as a business.
Okay, is that you, Keith?
Thank you, convener. Yes.
Yeah, right. Has there anyone else got any questions or comments? If not, we were just asked to review the Tayside contracts report. Do we agree that we've reviewed it and that we want to note it? Is that agreed? Well, thank you, Keith and Frank and Doug, for your presentation. You're free to stay for the rest of the meeting, but I'm quite sure you're busy people and you might take this opportunity to leave us. So thank you very much for your presentation.
Thanks very much.
Now move on to item 5, which is the internal audit activity update. And can I call on Cathy Wiley, please?
Thank you, convener. This is the normal activity update on the progress with the annual plan and also the actions that have been agreed from the audits that have been completed. And we've also this time got an appendix which is giving you information around the audit plan that was agreed for the current year for the IJB, and I'll say a little bit more about that when we come to that item. I'm starting on page 36 with just a little bit of information around some of the progress that we've had in general. We're still working on some procurement audits, which are just taking a bit longer than normal to complete, just because of the resourcing implications within that service and also the changes that are currently being undertaken there. But we are progressing those. And the other one is just an update on one of the staff who's been on secondment to the Council's Emergency Centre. When we wrote this report, up until the 7th of January, there were about 25 days had been spent from October, and he's going to be coming back to our service full time at the beginning of next week. And at that point, I'm expecting that we will have, probably out of this current year, about 40 days that have gone into the emergency centre. But at this stage, I'm not anticipating that that will impact on me being able to provide my annual assurances in June for 2021-22. So I'll just go on now to discussing the reports that we're presenting today, which is Leader, roads maintenance, and also an update around Audit Scotland's fraud reporting. So I think it's page 40. Yes, page 40 is the start of the Leader, and this is the EU funding for grants around agriculture, food and rural communities. And this is just coming to an end at the moment. We do an annual audit on this to a very strange date, which is the 15th of October each year. So this is the report on the audit up to the 15th of October 2021. And you'll see from page, sorry, I'll find it, here we go, page 42, that the overall conclusion here on the work was substantial. What we're doing with this audit is looking at whether we're complying with the service level agreement and that the procedures that we have in place are being followed fully. We've given it substantial assurance just because there are still a few things that need to be done around the closing off of the project and making sure that all of the documentation has been uploaded into the Scottish Government's LARCS system so that the record of all of the audit trail, if you like, is all in one place.
Cathy, can I just interrupt you there? Can you, what the acronym LARCS stands for? That was raised when we were discussing it.
Now, there we go. I'm sorry, I do not know what LARCS stands for. I've never heard it called anything else but LARCS. Rhonda McFarlane, who is working on this, is in the meeting just now. She may be able to answer that question. I don't know.
We'll carry on and we'll ask Rhonda afterwards.
Right, okay. Sorry, I've just never heard it called anything else.
It's okay.
It'll be local authority something, but...
Yes, it's just that you've got the acronym for Leader at the top explained and you didn't explain LARCS.
I know, and it's just because I've never heard it called anything but LARCS. I'm sorry.
Okay, let's crack on, Cathy.
Okay, in terms of the substantial assurance, we've got... that's just on the basis that there is still a bit of work. We've not got any actions agreed for this because there is a plan in place to get all of that information into the system before the 31st of March, when everything should be closed down, and that will be the end of it. There's just one other thing on this, on page 43. I've made the point about the paperwork being uploaded, but also during the year, the people who were running the programme left the council, and it's just a learning point for future programmes to make sure that there's a good handover between the people who are leaving and the new people who are coming in, so that they have a good handle on all of the information that's available to help them to close things down. The next audit that we're talking about here is the roads asset maintenance processes. And this audit, if I'm on to page 44 now, the purpose of this audit was to provide assurance around adequate procedures and controls were in place for road maintenance. And this audit was put into the plan just because people had some concern about the gap, and it was referred to in the previous item that was being discussed. And you'll see at the top of that page, there's a table that shows what we have been spending and investing in roads and what the carriageway backlog figure that's been estimated for the area is. And you can see that there is quite a gap there. So this piece of work was looking at making sure that we had adequate plans in place, that there were arrangements for identifying legislative responsibilities, and we were looking at procedures for making sure that we were recording and accounting for all the roads assets and coordinating that properly with repairs and maintenance schedules, that we were doing condition surveys, that risk assessments were taking place, health and safety procedures were being followed, and that there was information to allow monitoring contractors' performance, and that all of that was being presented in management information on a timely basis that would help with managing the whole process. So you'll see the conclusion on page 45 is substantial assurance in this area. But I just want to highlight that that is around making sure, that is around us having arrangements in place to make sure that we're mitigating and minimising as far as possible the potential impact of the risks that relate to the latest estimates of the backlog of outstanding works around road maintenance. We have identified some good practice, which is on page 46, I think. Yeah, there's a couple of good practice points there around the way things are being done. We've got planned improvements and changes there, and I think one of these was being referred to in the previous item. We've also noted that the development of service risk registers is currently underway, and so we've not made a recommendation around that because we know that that's already being done. And just a note there about extra funding that was made available at on the 24th of September last year. So there's only one recommendation in this report, and that is around, there was some training that had been planned and it had been delayed due to sickness and then further delayed due to COVID restrictions, and we're just reminding people that should be rescheduled and rolled out as soon as possible. And then the third piece of work we're reporting today is the review of Audit Scotland's fraud and irregularity report. They produce this report annually, and it summarises briefly things that have gone wrong in other places. And it's a chance for us to just make sure that our own arrangements around these areas are fit for purpose, and it's a chance to identify anything where we should be doing more. In the report for 2021, there were also some high-level recommendations that were made around the overall governance and control of making sure that you wouldn't be leaving yourself open to threats of fraud. And so on page 47 and into 48, there's a table that has these high-level recommendations and what the actions that are currently underway within our council are. I don't have anything in particular to draw attention to there, but happy to answer any questions if there are. On page 49 onwards, there are tables that show the individual case studies that Audit Scotland highlighted, and a short summary of the position in terms of the controls that we have in place around these. The overall conclusion for this is at the bottom of page 48, and that was that the current arrangements or the reviews that we've currently got underway should address the issues that are relating to the public, the other public bodies' issues, with one exception, and that was that we identified that we didn't have a comprehensive written policy or procedures to deal with private use of council vehicles, and it's been agreed that a policy on that will be produced. And finally, or second last on today, we've got the information around the actions and how they've been implemented. I don't have anything in particular to draw to your attention there. I think we can see that the older actions are being closed down. We've only got one action left now from 2018-19, and relatively speaking, things are moving forward with getting actions completed. And the final thing in Appendix 2, which is on page 56, I think. Yeah, page 56. As part of the data sharing information between the two auditors in the IGB, because the IGB auditor is the NHS auditor, and so our data sharing protocol says that the internal audit plans of each organisation should be shared with each other. So we've never actually done this before, so this is just bringing the IGB audit plan that was agreed back in June 2021. Sorry, excuse me. Just for your information, and just to let you know, the item at the very bottom of that page, which is the commissioned service providers, sorry, excuse me, is the audit that our team is undertaking, and that's fairly well advanced and almost at reporting stage. So happy to answer any questions.
Thank you, Cathy. Right, bids for questions. First one, Councillor Whiteside.
Page 48, please.
Councillor Duff.
844, please.
Councillor Miles.
It's not a question, it's to clarify what LACs are. That's local actions in rural communities. So that.
Sorry, say that again, Larks.
It's local actions in rural communities.
Rural
systems. But,
okay, thank you. Anyone else? Councillor Devine?
Page 44, please.
Anyone else? No? Right, let's start off with Councillor Duff on page 44.
Yeah, thanks, Convener. Yeah, I really wanted just to sort of ask a couple of questions about the roads maintenance, because it's quite an informative summary, I think, there. I think most of us know that our roads are deteriorating, but when you actually see the numbers, it's an interesting read. The first question, I guess, on the total expenditure invested, I am assuming that is revenue and capital. The second question I had really is in terms of we're saying there's a 25% decline to 18-19. It's declined since then. And if you look at the expenditure invested in 1920 against the backlog, it crudely looks like a sort of 7-year backlog. How much do we know how much we would need to invest each year to sort of hit equilibrium where we're just keeping pace with the roads? We might still have a backlog, but we could kind of work out how much that is. It would be interesting to know what is the target sum. That may be hypothetical because we can't afford to expend it, but it would be useful just to know that. Do we have any idea on that, Cathy?
I think Ian Cochrane is on the call and he is probably better placed to answer that question than I am.
You're on the call, Mr. Cochrane, please.
Thank you, Convener. Yeah, in terms of the backlog figure, there's also another figure that Scott's produced from the survey that we undertake, the SRMCS, Scottish Roads Maintenance Condition Survey, and that gives a steady state, but that steady state is only for the carriageways, so it doesn't include street lighting, bridges, footways, etc. My memory of that is it's about 7.7 million, but the system that Scott's used, the Society of Chief Officers for Scotland, who undertake the SRMCS surveys, is run about every 2 years. So we're currently awaiting the next set of figures. They're a bit overdue because of COVID and everything else. So that would include the latest backlog and the latest, as I say, steady state for the carriageways. It's a well-known fact that the need in terms of maintaining the asset is currently unable to be met from local government funding. I hope that answers your question, Councillor Duff.
Yeah, thanks very much for that, Ian. So effectively what we need to do is to take the gross spend, which was whatever is 8.9 in 2021, and strip out of that things like lighting, perhaps road safety improvements, etc. And that would get us down to the core carriageway spend, and then compare that with 7.7, which is the sort of professional guidance from Scott's. Is that right?
That would be correct, yes, because you've got to avoid things like winter maintenance and gully emptying and all of those costs as well. So it's a little bit of statistics. I think from the headline point of view from myself would be that in our capital plan we see something in the order of 2.7 million going into carriageways and footways on an annual basis, and as I say, the steady state figure is substantially higher than that.
Perhaps the pair of you, Councillor Duff, Mr. Cochrane, could communicate on this and just expand on those figures and let Councillor Duff have a written explanation at some time in the future.
Happy to do that.
Thanks for that, Convener. Yeah, I think that's a useful thing if we can follow up. Thank you.
Councillor Devine, you were on page 44 as well.
I am. I think it's a more simple question, and I think it is Mr. Cochrane who would answer it too. It's on the last bullet point of risk assessment processes. I was just wondering if cyclists are being taken into consideration now that we are trying to, well, we are hoping that more and more people will do active travel and be on bikes. I'm sure you yourself know, Mr. Cochrane, that the edges of roads are pretty dodgy at times, and they're getting worse with the weather and with the heavy vehicles. Are cyclists taken into consideration in the risk assessment?
I can't recall the risk assessment in detail, but we tend to take all road users into account. And I can certainly say, in terms of some of the roads I cycle on, I'm absolutely familiar with some of the challenges that they bring, Councillor Devine. I'm happy to try and pick that up as well off table if you wish.
No, that would be fine, thank you.
Okay, Councillor Whiteside, page 48.
Thanks, Convener. It's regarding the Audit Scotland fraud and irregularity report, and it's just a query around the recommendation for the policy of council vehicles. I just wondered if this was purely on the basis of best practice, or if there was any reason to suspect that we had an issue here.
I don't suspect that we have an issue here. It's just on best practice, because there have been a couple of issues in other councils where people have used vehicles for purposes that weren't anything to do with their work.
Thank you.
You still got your hand up, Councillor Duff. Is that a legacy hand?
Sorry, it is, yep.
Fine, thank you. Anyone else? No. Right, the recommendations are to note the update, note management's progress in implementing internal audit, and note the Angus IJB audit plan, etc. We agree to note these three items?
Agreed.
Thank you. We'll move on to page 57 and the item 6, which is the corporate governance action plan updates. And can I call on Gordon Cargill on this one, please?
Yes, is to update the committee on the action plan relating to the annual governance statement, which is the information is detailed in Appendix 1 to the report, and also for the Scrutiny Audit Committee itself, the self-assessment that was carried out was an action plan in relation to that, which is in Appendix 2. I think the details there, I'll not go through that. There is, just to draw the committee's attention, there's a few actions requiring requesting extensions to the original completion dates, and that information is detailed in the report as well. Happy to take any questions.
Any questions? No questions? Sorry, Councillor Whiteside. Page number, Councillor Whiteside.
Sorry, my machine's very slow today. Page 57, please.
Thank you. Page 57. Carry on, please.
Okay, it was just in relation to the delay in the social care billing audit. It seemed like quite a long delay till the end of March 2023. Is there any further explanation for the long delay?
Thanks, Councillor Whiteside. Yes, not close to the detail, but I do believe that there's a fair bit of work being done up to now in relation to kind of mapping out the processes involved in that. But I do believe that it's also to be integrated with a system in due course called Kpis. And I think we're just trying to work with the supplier in terms of how that's going to come forward in terms of implementation. So I think being realistic in terms of time frame, I think that's a period in order that we can ensure that that system is available to link into the whole new process.
Thank you.
Okay.
All right, thank you. Any other questions? No, in that case, we're asked in the recommendations to review and scrutinise Appendix 1, review and scrutinise Appendix 2, and approve the extension to completion dates on specific actions as set out in sections 3.2 and 4.2 of this report. Are we agreed?
Agreed.
Thank you. Let's move on to item 7, which is reports to council relevant to Scrutiny and Audit Committee, and that starts on page 66. And the list starts on page 68. I don't think there's anything that we need to refer to Scrutiny and Audit. Does anybody have anything in that list that they want to refer back for further investigation? No. In that case, the recommendation is we've reviewed the list and we've determined that no reports are subject to further investigation. Agreed?
Agreed.
Item 8, corporate risks and risk management, page 77. And I understand Mr. Armstrong is going to take this one.
Oh, I thought it was me, convener.
I think it is the chief executive on this one. I'm on the next one, convener.
Have I slipped somewhere? Right, okay. Right, okay, Kathy?
No, my name's Margot, chief executive.
Oh, sorry, I'm not seeing you down in the corner there, Margot.
That's where I belong, convener. Thanks for this. Yeah, item 8 is really an update on the work being undertaken to embed the council's risk management framework. You'll see that work around the risk management is ongoing and some of it's slightly delayed, and we'll bring another report in March. The report also asks committee to scrutinise the corporate risk register, and we've got a couple of changes in here that I just want to highlight to you. The dashboard is included. I think that's on the next page. It's on page 79. As far as the dashboard is concerned, there's change to one risk, which is the financial sustainability one, and we've changed that to revise it upwards to reflect the concerns about the current government settlement for local government and the ongoing work to ensure we bring in a budget in terms of the February outcome. There's a new risk has been added, which is the data migration risk. You'll see number 13 with Catherine Lindsay's name on it. And we've added that one because it's been escalated from the Children, Families and Justice Service Risk Register. And it's to do with the migration from the old system we had, the old IT system we had, to the new system, the Eclipse system. And we've discovered one or two anomalies in there. So we are really checking that one out in a bit more detail to ensure that that is as good as it possibly can be. The plan would be that we will manage this risk back down again. It will go back to the service risk register rather than sit at the corporate risk register stage. Happy to take any questions, convener.
Okay, bids for questions on item 8. Councillor Devine.
88, 99, 108 and 111, please.
Okay, Councillor Duff.
112, convener.
Anyone else?
Yes.
Okay.
No, I'm
Sorry?
here, Alec.
Right, okay, I didn't see you. All right, yes, Councillor Bell.
Mine's pretty cross-cutting, but I'm going to pitch for page 105. It'll wrap in some other items as well, though. Thanks.
Okay, fine, thank you. Right, we'll start off with Councillor Devine on page 88.
Page 88, yes. I was wondering just how far along the road we are with public engagement on the council priorities as part of the budget setting process. That's under likelihood, that is the last sentence there. I just haven't been aware of anything much recently, and I had thought that we had asked for this to start. I think it did start back in September, but I'm just not quite sure how far it's gone and what responses we're getting.
Okay, thanks, Councillor Devine. I think I'll call on one of my colleagues, either Ian Lorimer or Jane Stork, to respond to the progress that's been made to that, if that's okay.
Okay, yeah.
Convener, if you're happy for me to come in on that one.
Yes.
Yes, thanks, Councillor Devine. Yeah, we reported back to Council on the outcome of our consultation. It was a very high level consultation, you you might recall, I think it was November, we reported back, and what we're basically looking to do is use the results of that consultation as part of the kind of policy and budget decisions to be made by council when it comes to setting the 22-23 budgets in a few weeks' time. So we should be, each of the budget groups should be reflecting on the results of that consultation as part of that process. So the narrative there in the risk register update probably needs updated, actually, just to reflect that we've done that exercise. It was very high level for informing the 22-23 budget. We also said in that report back in, I think it was November, that we would be bringing new proposals to council after the elections in relation to the 23-24 budget process, and there'll be a new council in place, etc. at that point. So that's a good point at which to reappraise the council's priorities and the budgets that would then follow those priorities. Hopefully that answers the question, Councillor Devine.
Yeah, I think we just had hoped that we were going to have a bit more nitty-gritty, a bit more to hang on to for the budget groups to look at and to take into consideration. But we'll just have to wait until after the election now, clearly.
Okay, we stay with you, Councillor Devine, page 99.
Oh yes, this is just a kind of general question on the legal side of things. Just, are you satisfied staff complement is now sufficient? Because we have been aware of quite a backlog in different areas, and I know that there has been recruitment. So do you think that the complement is now okay?
That's a tricky question at the moment, Councillor Devine, because I think over the past wee while we have experienced absence, largely due to COVID, isolation, people being sick, people caring. We've also had 1 or 2 vacancies in different areas. In terms of our business continuity plans, as you'll know, we revise them really quite regularly through our gold, silver and bronze command, and to date we haven't had to draw on any of them. So it's a tricky question because we have been managing, we've been coping, but as we've talked about before at this committee as well as others, very concerned about staff well-being, fatigue, and what everyone's been dealing with over the while. I certainly look forward to the day when we have less absence and people are back fully healthy and engaged with their work. But as it stands at the moment, I would say we're doing okay. And we're performing well given the circumstances and beginning really now to turn our attention and energy to recovery. So I think, like any other probably business or public sector organisation, we're in a reasonable place to begin to move from that response situation that we've been in to recovery and innovation and creativity and all the things we need to do around change and transformation again.
Mm-hmm. Okay, thank you very much.
Okay, Councillor Bell, page 105.
Okay, thank you. As I already intimated, this is a bit of a cheat because there are so many cross-cutting issues here, but I thought I'd just dive in here on the Brexit point, but it obviously takes in so many others. So around climate change and the COVID recovery. When we're looking at such a complex picture, it's like 3 or even 5-dimensional chess. We're looking at rising energy costs, food shortages, rising food costs and deepening levels of poverty. I wondered if someone could give us a little bit more on the kind of markers that we're looking at to make sure that we capture how all of these factors are impacting on our citizens in their daily lives. I think, from our point of view, looking at this, and it might well give us confidence that risks are being managed, but I think it can look quite abstract. If you're a citizen without any previous knowledge of risk management, and I would just like some vivid pictures around what are the markers that need to be considered, and feel free to go into the complexity of it, because I do think it is really important. It does impact on people's lives, and it is literally not just a bit of paper. It would be good to see that brought to life a bit. Thanks.
Councillor Bell, I'll respond initially to your question. I might ask Mark Armstrong to come in on some of the poverty work, but you'll see on page 77 that we really are looking to close this risk off. And that's largely because of where we are in the cycle of leaving the European Union. And whilst you're right, uncertainty remains, particularly for business. But in terms of impact Angus Council, we feel that it's manageable currently. So we'll be wanting to get to a stage where that comes off the corporate risk register. In terms of the other areas and issues you raise, totally focused on them through a number of fora, in particular our community planning partnership, but also through the council plan and what we bring before members there. In terms of the COVID response that we have and the funding we've been given, again, it's been targeted very much, both in terms of physical resource, but also in terms of resource to those in most need. And as a community planning partnership, which I think it's a very mature partnership now, and I'm fortunate enough to chair that, most of the discussion has been around the vulnerability as a result of the pandemic, and considerable work has been done with that. Yeah, it's a big question, but I wonder if I just get Mark to add a little bit, because he has really been instrumental in leading some of the child poverty work, and that obviously impacts on families as well. So Mark, do you want to add to that?
Yeah, certainly, if that's okay, Chair. Thanks, Margot. So as Margot says, I think the Community Planning Partnership are looking at these issues on a regular basis. In terms of the particular work that the partnership's leading on in relation to child poverty, but really income hardship across the board, irrespective of whether it's family related or child related. You'll probably be aware, Councillor Bell, from your other roles, Public Health Scotland produced a significant piece of work in Inverclyde where they looked at a whole range of indicators for levels of poverty in relation to the drivers of poverty. And within Angus, we've been taking that data. So that really is in terms of a whole number of indicators in terms of qualitative data, but we're also doing some very innovative work, I think, that the Scottish Government are interested in terms of more qualitative assessments and develop experience and working across the Community Planning Partnership again, and particularly with our third sector partners and council and other services that are working directly with individuals and families who are experiencing financial hardship and seeing, the issues related to cost of living or having lost their jobs on the back of the pandemic, and really looking at that qualitative data in conjunction with what the quantitative data is telling us, and that is helping shape the next development and iteration of our Child Poverty Action Report. And I'm quite happy, kind of off this meeting to kind of share more information, but there's, as you can imagine, there's an absolute forest of data that we can look at. So one of the things that we're actually doing is determining which of the particular indicators that we want to focus on in Angus, and that will partly be driven by what the lived experience work is telling us of the issues that families are really experiencing, where we want to make a significant impact.
I think the only thing I would add really is that, we're still a council that has its own welfare rights team, and we know the benefits they bring to, huge proportions of people in Angus, including the benefits calculator, which is widely used. And again, you'll be aware of that, Councillor Bell, but their work has been significant at this time.
Okay.
Thank you very much.
Back to Councillor Devine, page 108.
Thanks, Convener. It's 37 COR 00037, delivery of CCAP. Has this position now been advertised for recruitment? And when do you think we might actually get somebody in place? I'm just concerned that the MOG has been put on hold until this person gets into place, and we really do need to get a bit of a move on here, I think. So that would be helpful to know.
Okay, and Vivian Smith's been leading on this work, so I think if I can ask Vivian to come in. Oh, is Vivian here?
Yes, she's showing. There we are.
I'm here, sorry, and I was chatting away without actually taking my microphone off, so my apologies. Thanks, Convener and Councillor Devine. You're absolutely right. This is a really, really important piece of work, and just recently, as you know, agreed the CCAP through Council. We are in the process of job sizing that post and putting a job description and other things together. We will be recruiting just as quickly as we possibly can into that post. We're looking just generally at services at the moment across my service area, and you know, we want to make this a really key piece of work for the future. We know from some of the early discussions that we've had around the council plan and the new community plan that climate change is a key consideration for people, and so this post will be instrumental in bringing the right partners together to continue those conversations as to what we want to do. So I get your concern, and we will be moving on this just every bit as quickly as we can.
Great.
And we're sticking with you, Councillor Devine, on page 111.
Oh gosh, what was that one? Oh yes, I have asked this question before, but I was just wondering if there have been any further discussions taking place about finding a new venue in Forfar for vaccinations. Just obviously concerned that the Reid Hall is out of commission for such a long time. We know it will be definitely till the end of March, but we would hope that it might be freed up after that if somewhere else was discovered.
Yeah, so there's been ongoing discussions around vaccination spaces that we have in Angus and the right venues for them should they be extended. And these conversations are still taking place with Public Health and Angus Alive. So I can't really give you a definitive answer on that just now, but we're aware of issues around Reid Hall.
Yeah, because there just are some empty places in Forfar that might be useful, but not in the public sector. That's what I mean.
Yeah.
Right, and finally, Councillor Duff, page 112.
Yeah, thanks, Convener. And I read the words under the number 1, the financial sustainability. I noticed the ramping up of the concern, and I guess as we're involved in the budget process, we don't need to ask a question about that one, but we note the comments. My question really was on the new risk, number 13, data migration. It's obviously quite a high risk. I noted that Catherine Lindsay is on the call, so I was really just looking for a little bit more detail on that one. And I guess what the timescale might be to sort of, if you like, normalise where we are on that one.
Yeah, thanks, Councillor Duff. And Catherine does actually have the detail, and it was her that brought it to the attention of the Corporate Risk Register. So I will pass on to Catherine.
Thank you very much, Councillor Duff, for your question. We have obviously included some detail in the summary there, but there's a lot lies behind this. Attention through a range of different routes over a wee period of time that we were finding some anomalies in the data. We have put in place a significant amount of checking our old data system, so we still operate both Care First and Eclipse, so the information is all there. But we had been led to believe that we could rely fully on the data that was in Eclipse, and that has proven not to be the case because there are some gaps in what has come over from the old system into the new system. So currently operational teams are now checking both systems every time they need to get information about a child or a family, to double check whether they've been known to us and to support us with our assessment process and make sure that young people are not left at risk. So it scored very high in terms of the level of impact. Basically, the consequences could be very significant for those children and and young people who are at risk. And that's why it's really, really important that we get this rectified. At the moment, we are manually checking thousands of records, tens of thousands of records against what was in the original system at the point of transfer and what is now in the new system. We're going through that process quite meticulously so that we can then have a proper discussion with OLM, who are our partner organisation in the delivery of this system, to look at a technical fix that will move any non-migrated data into the correct place on the new system. But of course, we need to really be very, very clear about exactly which bits of data are not right. And then they need to help us work through why that hasn't migrated, given the algorithms that they will have programmed in order to do that. So I can't give you an answer about the exact timescale where we will be confident that we have all the information that was in Care First and is in Care First in the new system. But what I can give you an assurance about today is that I'm satisfied with the level of support that we're receiving from corporate colleagues across all departments that need to be involved in this piece of work. There's a real understanding of the level of risk to real live people here in terms of this not being right, and the significant additional pressure that's being placed on frontline staff in terms of having to do the additional checking for every referral that comes in. So I'm confident that colleagues will be having those conversations with OLM and that they'll be pressing for an early date for resolution once we're clear about what the technical fix might need to be. So I'd like to be able to give you a date, but I wouldn't want to give you any false assurance about that. We do have a contract in place with OLM. They are our current provider of the system, and we are midway through a rollout to all social work and social care services, and that includes the financial module as well, which is due to be updated. So we're looking at this particular migration issue in relation to all aspects of that transfer from one system to the next. So we're using the learning, if you like, from what's happened with the children and families data migration to then interrogate and be clear about what's happened and what will happen in relation to the rest of the rollout. I'm happy if you've got any other specific questions to answer them as best as I can, and if I can't do that today, I'm happy to go and speak to more technically minded colleagues and come back to you with a response off table. Thank you.
No, that's very helpful. Thanks, Catherine. I mean, I'm taking it what initially happened, we did an automated data transfer, and that hasn't worked 100%. And I know these things can be troublesome, I think, I know from some past experiences in a different life.
That's absolutely right. So we had tens of thousands of nominals in the original Care First system. We migrated to the Children and Families module of Kpis, which is the same provider, who have upgraded, if you like, their interface. And they had written an algorithm to pull what was in the original system over into the new system. We had some checking took place immediately following the migration of the data, and we had checking prior to the migration, and all of that indicated that while there would be some anomalies, which there always is in any data migration that needed to be tidied up, it was fairly minimal. However, it's quite clear that there have been other anomalies that have arisen that weren't factored in. So we're also looking to support OLM with the process around that for future rollouts as well, so that we're much clearer about what interrogation there is in that technical switchover process. So yeah, absolutely, it was a kind of a hit the button and everything went, but obviously some of that didn't pull through in the way that it ought to have done.
Okay, Bill.
Thanks very much indeed, Convener. Thank you.
On the back of that, Catherine, can I ask, was this a basic system design failure by OLM, that their algorithms were just not up to the mark and it was an integral fault in the system?
So at this stage, what we're doing is we're looking at basically a download of everything that was in the system originally at the point of move, and then we're looking at what came over, and we're working through to see where the problems are occurring.
Right.
And then we need to have a technical discussion with OLM about why that might have happened.
Okay.
And it may be that there's something that could have been better in terms of the technical fix that they had in place for that, something that hadn't been anticipated. But at the moment, we don't know the answer to the question.
Fine. Can I also ask, has this affected other councils?
So we are well aware that there are other local authorities who are also rolling out Eclipse. We're not aware of any who are migrating from their existing system, so their data migration process is likely to have been different. Right. So my understanding is that the majority of the others are moving from a different system, one that wasn't in place through OLM to start with. So it's quite likely they've had to draft a different kind of migration process. But we have flagged that to OLM as a risk. And we are seeking their assurance that they have communicated that to other parties, and it's part of what the board are looking at when we meet again to see whether or not there are any requirements that Angus Council may have in terms of sharing our experience of that with other local authorities from a risk to children mitigation perspective.
Right. Councillor Whiteside, do you want to come in on this one?
Yeah, just a really quick supplementary, and you've maybe already answered it in your answer to Alec there. I mean, obviously the most important thing is getting the data, minimising the risk as far as that goes. But is there any financial compensation, do you think, or is it far too early to say whether that would be the case?
So these are questions that will be scrutinised as part of the Eclipse Programme Board process. It will depend, I suspect, on clauses in the contract and obviously what we think the causes have been, and OLM will also have their perspective around that. If there is any potential for financial remedy, obviously we would want to be picking that up with OLM. They are still our provider, and there's perhaps some scope for negotiation around that. What there is significant financial or rather resource implications within operational services and other support services at the moment in terms of trying to work through what has happened here, because only our staff can do that. OLM staff can't really support us with that. So that's using at the moment all of our support capacity within children, families and justice, and quite a considerable amount of senior management time and oversight, even to get to the point where we are able to articulate clearly enough to OLM exactly what we think has happened, for them then to have a look at the technical aspects of that. So we will certainly be exploring all the potential remedies that any contractual arrangements afford us.
Thank you.
Okay. Just get myself back to the start of this one. I take it there are no further questions. We're asked to scrutinise and note the information. No, that's not the one I'm looking for. I think I have jumped somewhere. No, I haven't. Yes, you were asked to scrutinise and notice that about the health and safety risks. We've also got to decide. No, that's wrong. It's got to be.
Convener, it's page 77.
That's right, page 77. Yes, that's the one I was on. I'll go back to that. It didn't look right. Right, okay. Page 77, yes. We're asked to note the ongoing work taking risk management forward and scrutinise the corporate risk register dashboard and risk contained therein. Do we agree to note?
Agreed.
That's fine. I was getting stuck on the next one. Right, so that's page 115. And it's Mr. Armstrong who's going to take us through the health and safety risk register.
Thank you very much, convener, and thank you, committee, as part of the overall kind of programme of looking in detail at specific risks within the register, the corporate risk register. So today we're looking at the risks related to our health and safety compliance, and particularly the council ensuring that we are able to meet our legal obligations in relation to the health and safety at work legislation. As you'll see from page 117, the risk assessment is currently scored at 12, and our risk appetite, as is detailed further down for this risk, is detailed at 6, and we've also detailed on page 118 the additional actions that we're currently working through to bring that score down to within our appetite level. So what we will be doing today is Paul Conroy, my colleague who leads the team in the health and safety section and has been leading on our resilience work generally for the last few months, is going to talk through some slides in a bit more detail around those actions that are detailed on 118 and to give the committee a kind of deeper insight into what that means in practice and from that hopefully provide the committee with assurance that the work that's been undertaken is going to address that risk issue and bring us back into a kind of controlled environment. So I'm pleased to have Paul with me today. Him and his team working across the council have been doing a power of work on this. And as you can imagine, during the last 2 years of the pandemic, that's whilst they've been juggling a whole range of other issues and demands as well. So I'll hand over to Paul and he's going to talk you through some slides and then we'll open it up for questions.
Thank you, Mark. So this presentation should only take about 10 minutes. Following on from Mark, our overall risk score is currently sitting at 12, and this reflects our current position as the majority of our data is currently held within different systems. The score has been calculated despite existing controls in place and has a potential impact on the Council's health and safety compliance. We have a one-system solution that we've currently implemented, which will allow us to capture our data across 3 management modules of instant, risk and audit. And this will allow us to analyse the data in one place and enable us to both measure and place, both measure and improve our health and safety performance as a council. We currently have in place an East Scot partnership with Clackmannanshire and Perth and Kinross councils. And as I said, we've been sharing guidance and collaborating together on all health and safety matters. And we've got an agreed development plan in place. All the associated information, instruction and training, the arrangements, guidance, toolbox talks and training solutions that we currently have in place to meet our health and safety legislation is within this development plan. And we are intending to present this to the COSLA Excellence Awards once we've gone through the plan, do, check and act cycle with the system as an example of best practice through our collaborative efforts. The Corporate Health and Safety Action Plan has been impacted by the pandemic, and it's been difficult for us to consistently commit to our development work against the changing demands we've encountered as a team. Our Corporate Health and Safety Action Plan and our East Scot development work is intrinsically linked, and this presentation helps to explain where we currently are and the actions we're currently taking to complete these tasks in a collaborative and proactive way. We know the importance of completing these actions and our development plan that's in place, which is vital, and we're also recruiting to enhance the team to support our East Scot project. This will include the build and the rollout of the digital system and to oversee the development. The risk management module has several risk assessment arrangement types embedded into the risk management module: activity, individual, stress, display screen equipment, home working, noise, vibration and manual handling. Several of those required risk assessments must have arrangements in place which follow health and safety legislation, and additionally our guidance and training must be reviewed to support the digital system. We must also ensure that each set of arrangements is accurate and consistent on our web pages, and this includes the training which we will be delivering and making available to our employees. Currently the templates are being built into the system and we're progressively working through the guidance, and training will be considered as part of the training element highlighted in the risk register. We are developing a performance monitoring record tool, and this is an important part of the project to enable us to reduce the score. Once the performance monitoring record is completed, it will provide the service with a risk profile and on full completion provide an action plan, and this will enable a full check of compliance with health and safety legislation and approved codes of practice. And we shall talk more about this in the next slide. We're reviewing our health and safety training, and the risk register also contains a section on training, and we'll cover this more in depth. Prior to full development rollout, the team are providing direct support to services and updating our guidance to meet changes and supporting our services to ensure that risk assessments are in place. Currently, the data is held on different systems, so it's difficult for us as a team to monitor and assist services without contacting them directly. Our corporate health and safety policy requires us, following legislation, to put in place arrangements on how we shall manage topic-specific risks. Services have systems in place to control risks. However, we do not have a one-method approach to record and analyse the data, so our one-system digital approach will rectify this. We're currently developing the performance monitoring record into the digital system, and each health and safety statute has a set of responsibilities and actions which the advisors assisting each of the services must either interpret or find an approved code of practice for, and write out a specific set of questions for the services to answer. We're calling this the performance monitoring record for services to complete in relation to the activities and risks they must control, and it will be a collective piece of work as part of the SCOT collaboration. On completion, it will give the service the action plan, allowing them to put those mitigations in place to improve health and safety performance, to achieve either full compliance or improve as best practice. And once the record data is held on the system, the Council will be able to monitor this. The data will assist the services with improving their health and safety performance, and we should see improvement to our health and safety systems, our guidance, risk assessments, training, monitoring, reviewing, reporting across the Council. A key part of the work that we're doing is also our KPIs, our key performance indicators, to identify gaps and share best practices in the Council and with our partners. With our new agile approach and the pandemic restrictions, we must review our training delivery. Historically, the team would deliver health and safety training to employees face-to-face within a classroom setting. The pandemic has prevented this. Some of our training courses were for 6 hours duration, and it's difficult for us to deliver this model approach, so we are currently reviewing this and adapting and considering a new blended approach, and the team are working in partnership as part of our eScot development to do this. And the team members initially were trained as train the trainers to level 7 through Scottish Qualifications Authority, but due to turnover, only one member of the team is left holding this qualification, so there is a gap. We intend to develop the advisors using the L&D budget to train our staff in the coming year, and in support to the team, we also have the expertise of our organisational development team. We have good collaboration within each other, and at the end of last year we finalised the fire awareness training with their help, and once the eScot development is in place and fully implemented and all our guidance is there for our employees to support them, then we should be able to develop the training further to meet the system's needs. But in the meantime, to mitigate this, we are still assisting services within the team in providing that one-to-one support directly to services until our new training model is in place. All councils agree that we can share and simplify our training into a one approach. It can simply be rebadged for the individual council, providing that the guidance in the system are the same for the topic being delivered. and mandatory training as well as toolbox talks to complement our arrangements, guidance and digital system are currently being considered. And once ready, all the data will be held on resource links so our training performance can be monitored. There have been a number of significant challenges over the past 2 years, and the team have remained resilient throughout and looked for solutions to overcome these challenges on a regular basis. And some examples are our team staffing levels have fluctuated for a number of reasons. Additionally, we've lost a member of the team, and COVID funding was approved to recruit 2 positions. And recruitment to fill a permanent post has all been a challenge. And this was really due to the need for competent and professionally qualified applicants, yet the lack of suitable candidates applying. So to overcome this, we've implemented a career grade structure to allow us to increase our opportunity to bring in applicants with transferable skills and allow us to develop and nurture applicants. Pre-pandemic, the team would occasionally be contacted by the HSE regarding complaints from employees' representatives about Angus Council, and the complaints would be in relation to health and safety incidents, near misses and our processes and procedures. However, during the pandemic, the Council has been engaged with and involved the trade unions over risk assessment controls and consulted with them fully. And this has been a real positive relationship which has benefited the Council through a collaborative approach to ensure that controls are effective, consistent and follow up-to-date guidance. And the trade unions have commented that Angus Council has been a leading example to good risk assessment processes in comparison with other councils. The trade unions now contact the team directly, service leaders also, and bring concerns to the Health and Safety Consultative Group on a regular basis. Good practice as well as areas for improvement. The HSE have contacted us once in the past 18 months as a result, and once the HSE visited on follow-up for that issue, they actually seen best practice across Tayside within that activity area. The pandemic proves to continue to be a burden on the team, as well as we're all aware of that the disease mutates and the risk evolves, and this means that the guidance has forever been changing and impacting on our essential services and risk management. And the team are continuing to support Council services in a coordinated recovery response through our efforts to ensure that effective communication and controls are in place. And the team have faced challenges along the way, not just during the pandemic, but also the recent severe weather and Storm Arwen. And the Council services all pulled together to provide a coordinated response, and the team supported this effort through the Council Emergency Centre. And finally, collaboration with the services and trade unions throughout the pandemic has proved vital. Services continue to submit risk assessments with revised track changes following our step process. They're shared with the trade unions to comment or take note, and this has proven a good example of collaboration or relationship between the team and the services and the trade unions. And the team have played a pivotal role in assisting with this, and we continue to do so. And we meet and support our HR services and alongside the trade unions on a fortnightly basis. So that's the end of the presentation. If there are any questions.
Right then, bids for questions. Councillor Bell.
Hang on.
No.
Is that it?
Yeah, bids for questions.
Yeah, a general question, please.
Anyone else? Councillor Bell.
Okay, thank you, and thank you, Paul. I suppose in the a spirit of openness, I do declare that I used to work in the team with Paul But thank you for all the work that you've done on this, Paul. It doesn't seem that long ago since we were discussing this in the chamber, and yet so much time has passed. You've put in a power of work on this. I guess it's a very broad question, and you might not be able to answer it, but I think one of the things that we would want as any organisation really embed the spirit of health and safety throughout the organisation, because it's not just those with health and safety in their job title. And I want maybe give me a view on where we are as an organisation around that at the minute, maybe on a scale of 1 to 10, with 10 being 100%. Just to give us a wee in of the work that you've done and where we need to get to. But thanks very much for today's presentation.
Thank you, Councillor Bell. I think, in all honesty, looking back where we were pre-pandemic, we were reporting our health and safety incidents across 4 systems. The intention now is to put it into one system, and we've actually now got that one system approach. So we will see a change there as we start to capture the data. Again, pre-pandemic, we were completing our risk assessments in individual service areas, but we were unable, from a corporate governance point, to look at the links between those incidents and ultimately the controls that had to be improved to prevent that incident from happening again. And there was a serious lag there with chasing up information, whereas what we will have now, what the services will have now, is they will have all their incidents on one system and also the risk management module. And then additionally, we will have the audit function to be able to carry out that proactive performance monitoring as a council. So what I would say is that we've definitely improved since the last time, you know, that you were in the team, and I would say that, you know, what the presentation
Thanks for that, Paul.
Okay, but the risk profiling is what's missing, and once we risk profile, I could give you a score.
Fine, Councillor, sorry, Mr. Armstrong.
Yes, thank you, convener. And I don't think that was meant as a personal comment, Councillor Bell. I think it was just noting a point in time. But what I would add to Paul's comment, and really, I think in terms of the council's coordination and response through the pandemic, and particularly the work that's been done at bronze, silver, and gold level, I certainly have noticed a significant kind of corporate and collaborative culture developing around working jointly with the health and safety team and continually reviewing and revising guidance and making sure that our workforce were adequately informed and the appropriate controls were in place. So I think Paul's quite right. I think over the last 2 years, one of the benefits that have come out of the pandemic is it really has accelerated that cultural shift around, and I would never have said there was a situation before that people didn't accept that health and safety was everybody's business, but I think people are now a lot more actively involved in that process, because the risk assessment environment that we've been operating within has been so fluid and so dynamic, and it's really involved a lot more staff than we would in kind of normal work in practice. So I think we have shifted, and as Paul said, I think also the changes towards our approach to learning and development and how that's delivered in relation to our health and safety responsibilities. Again, the pandemic's provided an opportunity to change that and to make it far more accessible through that blended approach. And again, I think we'll see the kind of fruits of that in future reports.
Thanks, Mark. It does often take a significant event to help people make that big leap. So I appreciate that, and thanks again, Paul.
Okay, that's finished on that one. We've got 2 recommendations. First one is to scrutinise and note the information presented about the health and safety risks. Do we agree to note?
Agreed.
And the second one is we are asked to decide which risks should be presented in March 2022 climate change risk from the original programme or the new data migration risk. I'm obliged to Catherine Lindsay for the explanation she gave to us on the data migration risk, and I feel that there's a lot there that's got to be developed, but I don't think it's ready for a higher level look at it. I think we should stick with the original programme and stick with perhaps bring the data migration as a very early report to the new Scrutiny and Audit Committee appointed after May. Is that agreed?
Agreed.
Agreed, thank you. Right, come to the final item, page 120, and I'm going to ask George Bowie to talk us through this one.
Councillor King, it's myself first, please.
Sorry?
It's myself, it's my report.
Oh, it's you first, sorry, I beg your pardon.
It's okay.
Margot.
It's good that George is here and he'll certainly be helpful for the report, but I think it is important as one of the chief officers of the council's COG, the group that every council must have in Scotland, that I present this report. As members will be aware, the Chief Superintendent, Phil Davison, chairs our COG presently, and the roles for a COG are set out by Scottish Government, and essentially we are individually and collectively responsible and accountable for the safeguarding and promotion of welfare for adults, children and families within Angus. On the 22nd of November, members received an extensive briefing about P19, and the colleagues in the Health and Social Care Partnership who were commissioned to carry out the review gave a very good and extensive presentation to members, including outlining why there were 59 recommendations assigned to a range of agencies, which included Angus Council and the Angus Health and Social Care Partnership. And since the publication of the report, work has been ongoing locally and with Scottish Government to agree the steps to prioritise and progress the full range of recommendations arising from the report. At 4.2 in the report, you will see that the Minister for Mental Wellbeing and Social Care has taken the decision and is in the process of commissioning Health Improvement Scotland and the Care Inspectorate to work with the Angus Multi-Agency Partnership. And the commission, although it's not been finalised, it is intended to identify local and national learning. 4.4 in the report identifies the 3 specific recommendations for the council, but we need to bear in mind that P19 was an Angus resident, and it's appropriate for this committee to review the initial improvement actions which are there in the plan, and also quite rightly ask a report to come back. And as you point out, Convener, George Bowie is here. He sits on the Adult Protection Committee, which reports into the COG and has been very close in working with this and the team who did the review. Ewan West is the independent chair, and he was there when members were given the presentation. And a considerable amount of work has gone into looking at actions as a consequence of P19's death. I'm happy to take any questions, but as you say, Convener, pass over quite rightly to George Bowie from the Adult Protection Committee.
Thanks, Margot. Yeah, I would be happy to say a few words about how the action plan came about and where we're at with it and why. Margot's explained the governance arrangements. So P19 died in late 2018, and an initial case review was undertaken first of all, which is often the way, and sometimes the initial case review or ICR will recommend a full significant case review, and indeed that's what happened, and work started on commissioning that SCR, arranging it in 2019, working through to the publication on 25th November 2021. So up to that point, only a mandated subgroup of the Adult Protection Committee were aware of what was likely to be in the SCR and had seen the draft report and recommendations.
So as Margot said, I was close to that. I'm Vice Chair of the Adult Protection Committee and was a member of the mandated subgroup, and I'm also the lead for adult support and protection in the partnership. So I was able to access that information, and the benefit of that was that we were able to make a quick start on some of the concerns that emerged from the initial case review. But it's worth pointing out that a lot of the involved professionals only saw the report for the first time when it was published in November because of reasons of confidentiality to do with publication and so on. And that means that folk who are engaged in enacting the improvement actions are at different stages of the process. And the report will look like half-finished work, and I recognise that it is really half-finished work or in the very early stages. We're now meeting weekly to progress the action plan. There's a meeting tomorrow morning, in fact, and there was one last week. The version that you have in front of you, because of the timing of the papers being submitted for committee, was the first version really that was considered by the mandated subgroup in early January. So it's very much in its infancy, and you can see that it requires quite a lot of further work. As Margot explained, the reporting timescales have been the subject of negotiation with the Scottish Government in terms of the Commission, and they are that a status report be submitted on the improvement actions that have commenced, and indeed some of those are completed by mid-January 2022, so that has happened. Secondly, a process and future plan for wider improvements to be in place by the end of January, and we're working on that. And finally, a full work plan to be in place by the end of February 2022. It's worth saying that a lot of the actions are complex. The quickest and easiest ones we've done already, and a lot of them are multifaceted and involve a whole range of agencies. And there's also an overlap with other adult protection work that we are doing. For example, the Adult Protection Improvement Plan. I instructed a large-scale audit of adult protection work in the Health and Social Care Partnership in December 2020, and that was completed. And generally, I wanted to be reassured about the state of health of our work in adult protection work, and I was. It came away with a lot of positives, but of course there were things that we had to improve on. We have an adult protection improvement plan for that, and it does overlap a bit with SCR P19. So that's where we are. I'm happy to take questions. The partnership's a big body, and some of them I might not be able to answer, but I can get back to people with answers. Thank you.
Right, bids for questions. Councillor Bell.
Page 123, please.
Right, Councillor Bell, page 123.
Okay. Thank you, Margot and George. I think possibly, George, you may well have answered this for me, but I guess I wanted to acknowledge, you know, I'm heart sore for everyone involved in this P19, the people involved in different services, and there's a real tension between capacity, human rights, risk management, those decision-making processes and the roles and responsibilities. It is incredibly complex, and I absolutely get that. I wanted to pick up on the top line on page 123, view of the contract that helped to live at home. And I wondered if any other, and I hate the phrases close call or near misses when it involves people's lives and health and well-being, but if there had been instances picked up of that initial review where gone as well as they should, and that contribute to the action plan, taking it forward. Thanks, George, and thanks for your input.
I can comment on that, Julie, that it would be fair to say that we didn't identify high-risk situations in looking at our commission service work with providers, and we didn't identify them through the adult protection large-scale audit either. It which I say was 96 cases, so it was a big audit. That's not to say there are not risks or challenges in those arrangements. Of course there are, and they're very pressurised at the moment because of capacity issues. We've got various systems in place for scrutinising the quality of commissioned services. They've been around for a while, and we just work on improving them as we go. We introduced a new priority operations group, meets weekly at service leader level about 3 weeks ago, mainly because some of the challenges around capacity and the potential risks involved in that, and they actually prioritise cases according to need and risk in our discussions with the service providers, and we have final say of the prioritisation in that process. So we've got quite a number of systems in place for monitoring the quality. I think they're pretty robust, but we will never eliminate risk completely in that kind of arrangement. Of course, to be an approved provider, you have to have adult protection procedures in place, and they have to be to a standard that we're satisfied with in order to get on the framework.
Okay. Anyone else? No? All right, let's have a look at the recommendations. We're asked to review and scrutinise the review and scrutinise the initial improvement actions, priorities, note the ongoing work, and agree to receive a further report detailing progress against actions in autumn 2022. Are we agreed those recommendations?
Agreed.
Fine. Agreed. Thank you very much, everybody. It's been quite a while today, but we've got through a lot of work. So I'll see you all again later.